Hi, I'm Dr. Mishock. I'm a licensed physical therapist and chiropractor. Today we're working on a shoulder patient. The patient has shoulder pain, and in this case we would do a complete exam and also history before doing any treatment. What I'm going to start with is what's called fascial manipulation. So I'm going to work some of the rotator cuff muscles through here in basically rhythmical fashion using the pads of my fingers. I'm going to work that for about 30 seconds to 2 minutes. Now with fascial manipulation, we're looking for points. They're called motor points. These motor points are linked to the fascia. The fascia is the covering of the muscle. The fascia basically connects all tissues through the body. By working these points, we'll help to relieve the fascia, restore its function, allow the patient to resume their normal function. Now next what I'm going to do is I'm going to use a technique called active release. So same muscle group here, the supraspinatus, which we were on there. I'm going to have the patient turning their arm back and then up. And then what he's going to do with this is he's going to feel some tension underneath the pads of my fingers here. So the part of the shoulder, the supraspinatus, where there was dysfunction, I'm going to take a contact on, and I'm going to have him actively bring the arm behind the back, just like this. And then back again. Now the idea with the active release technique is that the same point there is going to be used, and he's going to also stretch the fascia as we did previously. Go ahead and bring it back behind the back. And then forward again. Now this technique would be used for rotator cuff tendonitis, bicipital tendonitis, bursitis. Those are typical terms you would hear. Go ahead again. And then back. We'd next move to some of the other muscle groups in the shoulder here. In this case it's the infraspinatus and teres minor. I'm going to do fascial manipulation here, finding these points, motor points that have issue. I'd work those for roughly 30 seconds to 2 minutes. And then I'm going to go back into doing active release. In this case here, what we're going to do is we're going to take a contact in the back of the shoulder, and I'm going to have him bringing the arm across his body. I'm going to take a contact right on the dysfunctional tissue, and this is going to create a dynamic stretch for that area. And then back. Again. And back again. The next part of this we're going to do is a similar muscle group, but I'm going to take it into what's called internal rotation. So I'm going to take a contact on the back of the shoulder, and we're going to have him turning in. And these are some of the techniques we would do for shoulder pain, bursitis, tendonitis type of dysfunction.